Hi, my name is Lauren Brown. I am the chair of the Integrated Fertility Symposium. I'm also the clinical director of AcuBalance Wellness Center, located in Vancouver, British Columbia, Canada. And today I'm talking with Dr. Olivia Pojer. She is from Graz, Austria. And I would like you to give a little bit of your background because we're going to talk about male fertility and the importance of the man when it comes to optimizing fertility and getting to that healthy baby. So can you tell us your background? And just spoiler alert, she's trained both as a medical doctor and as an acupuncture clinical herbalist. Olivia, please tell us a little bit about yourself.
Okay, so what else to add? Well, as you said, I'm yin yang in one person. So I'm Western medical doctor and I do TCM as well. I'm an international speaker, mainly on male fertility. I wrote a book on erectile dysfunction treatment with Chinese medicine. Actually, at the moment, I am just writing on a book on male infertility treatment with TCM. I lecture at the Medical University of Graz, so I do train future doctors to be aware of what acupuncture can do. And I'm a fellow of the ABORM as well.
Perfect. And the ABORM is the American Board of Oriental Reproductive Medicine. So is it important for the guy to be assessed and part of the treatment? Because right now, currently, more often it's the female getting treated, even if it's male factor, not even from what goes into the Chinese medicine clinic, but when you see women going through IVF, they're doing IVF because it's male factor.
So just imagine you're looking for a treasure and you have 2 rooms you could go in. It's ridiculous to only search for the treasure in 1 room. Yeah, so nobody would do that. So same is with fertility. You need to have 2 rooms searched for the cause why it doesn't work properly, and then you need 2 partners to be treated. Okay, otherwise you're missing 50% of the puzzle. Yeah.
And 50% of the cause of infertility is attributed to the male. Yes. So the semen analysis quite often comes back as normal, right? Is it true, though, that even if you have a normal semen analysis, sometimes that poor fertilization or recurrent pregnancy loss, that unexplained infertility or unexplained recurrent pregnancy loss, even though the semen analysis is normal, do you see that attributed to the male?
Yeah, yes, that's very often because you only, you just dig at the surface when you have a semen analysis, and they changed a lot in the norm values of the semen analysis. So what would have been pathological in 1998 now is said to be normal, which actually isn't normal. Yeah. So that's quite complicated fake.
I want to clarify that then for the listeners. So the normal semen analysis today, so basically they changed the range. So they brought so what used to be considered to pass was an A. And if you had an F before, now that's the new A.
Yeah, true. Yeah. So they were kind of lowering the norm values so that anybody could have a non-pathologic sperm test. Yes.
Right. And that's just the way they figure out what's normal is they look at the population. So everybody's not, subfertility in men is now normal. So everybody's considered normal, although that doesn't mean you're fertile necessarily.
And the other factor is that with a sperm analysis being okay or good, it's just, a look at the moment. Yeah, it doesn't represent really the health condition of the semen. Yeah, from an overall perspective. So just imagine, or you only see how sperm looks like, but not if it functions properly. It needs to be able to fertilize an egg, and therefore it needs to swim and it needs to overcome some issues, to reach the egg. And we do not test that capacity. Right. Yeah.
I've heard somebody say that it's like it's the contents of a book without reading the book. And or if your semen analysis is normal, doesn't mean you can give life. But if you have really poor semen analysis, it also means you won't create life, but it means you may have a challenge. Now in Europe, it sounds like you guys are doing something different. You guys are doing more testing now for the sperm, the DNA fragmentation.
Well, obviously, they are now focusing on DNA fragmentation tests prior to the starting of an IVF or an ICSI. But still, I do think that we are far behind the US. And maybe, I don't know what the situation in Canada is, but the US does definitely do more DNA fragmentation tests than we are. And interestingly, India is the country you want to live in to get the best male infertility treatment.
Why is that?
I'm not really sure.
What is it, because of their testing, you mean? Is that why it's a good place?
Yes, because they are, I don't know why, but they are digging the deepest and they are having and gaining the most knowledge about male infertility, and they are testing the most. So there's the lowest barrier to get really good, also functional sperm tests, for example. Yeah.
And then clinically, do you see it different if you're seeing just a woman in your practice for fertility versus the man and the woman? Are you seeing different results clinically? And why do you want the guy to come in? How is this going to benefit this future baby?
When a couple comes in or wants an appointment, or for example, most times it works like this. So the woman wants an appointment. Yeah. So the female calls, and it's all her effort that they are getting an appointment. And I want them to come in as a couple for the first appointment, because I want to see the interaction of the couple. I want to get a clue whether really both of them want the baby or one forces more than the other one. So that's something I really want to figure out. And then I want to clarify what is the part of the female, what is the part of the male, but everybody gets his homework. And sometimes I choose, okay, the male has to come in for acupuncture as well. Yeah, if he's really afraid of needles, we might only do herbs or supplements. But if I could really choose, I would like to treat them both equally with everything the TCM has to under his sleeve to benefit both of their fertility. Yeah, just to have the best outcome.
So clinically, when you treat the male, you go over diet and lifestyle with them. So smoking, alcohol, hot tubing, you have the diet, and then you do Chinese herbal medicine, supplements like antioxidants. And then with the acupuncture, once a week, twice a week, for 2 weeks, for 12 weeks, just for the men that are watching this, what would they expect if they're going to visit their local acupuncturist that specializes in treating fertility?
Yeah. Okay. So considering that the development of sperm from the germ cell to the spermatozoa as we know it, yeah, this one, takes about 72 days, yeah, and that's our treatment time, okay? So we want to kind of get them from kindergarten, yeah, and educate them to be good sperm, yeah, and that education takes until they are grown-ups, yeah, and can be left into the ejaculate. That takes 72 days, and that's our treatment time. So I want the man to come in the clinic once a week for about 8 to 10 weeks.
Great. Once a week for 8 to 10 weeks. Thank you for that. It's just nice to hear this because, again, you're trained as a medical doctor and also trained as an acupuncturist and clinical herbalist, and seeing how you do this integration in your clinical practice. Are there any medications? And I'm going to ask a specific one. Clinically, what's your thoughts on these, the pump 2 inhibitors, somebody that's taking it for stomach acid? I'm thinking of a patient that came in and they've been on it for years, actually.
Yeah.
Can that affect the sperm fertilization? What's your thought on that?
H1 inhibitors, like cimetidine, for example, but not the H2, the proton blockers. According to studies, they don't harm sperm. Yeah. but the H1s do. Yes.
Perfect. Thank you for answering that. So if people want to find you in Graz, Austria, they want to connect with you, what is your website? How do people find you?
It's www.tcmordination.at for Austria. Yeah.
Perfect. Thank you for that. And again, if you're in the Vancouver area, you can check us out at AccuBalance. If you're in Europe and near Graz, Austria, you can talk to Dr. Olivia Pojer as well. And again, I thank you for the publications you put out, the books you're writing, the lectures you're doing, and the work you're doing, and for sharing. We just had you put your lecture together for the Integrated Fertility Symposium for health professionals. So thank you for putting that together and making time to chat with the public.
Thank you for having me.